should you use a back brace for your acute strain, new pain back injury? And the answer is, it depends. It's not a straight out yes, like heat or ice. It depends, because if you've done any research, you may have read that back braces are known to cause muscle weakness and set you back. And that is true. That's accurate information. And I can give you my personal account of it happened to me. So again, 20 plus years ago when I first herniated my back, and if you had read my story, I have that odd congenital deformity where I'm missing a part of a bone. So as an infant, my nerve bifurcated, which means it split, and it grew extra thick to take up the space of that missing bone. So when I first herniated my first disc, I couldn't stand or weight bear through my legs for a few days because that nerve was being pushed on with the swelling and pressure in the disc. Anyways, point of the story is I finally was able to come upright and hear that, but I still was so limited in my ability to tolerate upright weight bearing that someone suggested, I think it was my roommate who was a PT, to use a lumbar support brace. And when you're desperate, you're like, bring it on. So, I didn't do the research back then. I didn't know it could create weakness. So I used it. And man, I'll tell you, it takes off some of the pressure. I was able, instead of tolerating standing for like 10, 15 minutes walking around, I could do 45 minutes. And then it helped me get back to work. So where I'm treating patients and I have to bend over a table to work on them because I love manual therapy. So I used that brace to get back to work, and then I used it because I didn't know better for weeks and weeks until I lived the consequences of that, which is I just couldn't be without the brace. And I would like say go shopping. I remember this too. I went shopping without the brace. I had been using the brace all the time. I just thought, no big deal. I'm not working on patients. And I kid you not, it was clothes shopping. And I remember finding like one of those big racks with longer clothes because I lied down in the store and tried to hide under the rack, having my knees up for a minute just to unload like my spine. I could not be up a second longer. I don't know where my car was, but I was desperate. So I'm like lying down in stores now. And then I realized I am dependent on that brace. I was better before the brace. I was at least able to go longer. So I had to wean off of the brace. Long story to say, it has its place for a very short while to help you get through a task in the beginning of an injury. There are certain things we just have to do in life, and that brace might afford you that ability and splint that area. But I really don't recommend them in totality. I don't recommend them overall, and I advise against them because they do create weakness. And then I'll always say, like, I had a patient just recently who had to go to their daughter's wedding. Come on. And just was in so much pain. So I recommended a back brace. Get through that special day with as much support as you can. But don't become dependent on it, and be leery of them and wise to them that they actually, even though it's not tons of support, it is enough to create weakness. So that's my, yes, of course, long answer on back braces. Use them very sparingly, very wisely, and very little. Good luck.